So we greatly improved mobility of the patella. That moves side to side freely now. It moves inferiorly. I can squeeze it and it lifts up a little bit. The mid-thigh now has spring mobility. Let's have you lie on your stomach. His hip extends now fully on the left. And that's what released that patella, was restoring hip extension. Okay. His strength is much better now. We tested his quad strength, and before it was inhibited, and now it's very strong. And he had a lack of inferior motion through the pelvis. This is restored. Let's have you lie on your back. You had a lack of posterior rotation of the pelvis, springing on the right, and now that's much freer. You had some impingement of the left hip, but that I did not change. We showed that. I think you got a little bit of a gain of flexion.
Yes.
I'm actually taking you to 105 degrees.
Yeah.
So we did achieve that, but what we don't have is an improvement in this scour test. You still have a restriction at about, like going from 11 o'clock to about 9 o'clock or 8 o'clock. You have a restriction there. That's internal architecture of the bone, the bony development of the hip joint. I'm not going to change that. We improved this motion here. This is now much freer when I spring the scapula through the acromion, and your neck traction is much improved. So I can now take up the slack and spring it. There's movement through the whole body. And when I put you in extension, I can still get traction, and it comes to a stop, and then I add additional force, and there's now movement all the way down to your feet. And so this is a summary of the treatment to the whole body, which took us nearly an hour. And can you give us a summary of how you feel overall?
Oh my gosh, it just feels like I don't remember. It's taken like 2 years since my last set of injuries, and I've just felt like a mess and haven't felt like a normal person. I haven't been able to walk normally. I haven't been able to sleep. I always felt like I was having to figure out how to walk, how to swing my arms, and that natural feel where you don't have to think about, normal body motions. I can feel it coming back already.
Yeah, nice. I think, restoration of normal movement should be unconscious. Your body should unconsciously move normally.
Yeah. Yeah.
And the same thing for improved posture. We have improved posture of your hip, of your pelvis. Before in standing, your left knee was bent, and now when you stand, it's straight, and the shoulder was forward, and your head was hyperextended, and now those are much improved. And posture should be a natural expression of the body. It shouldn't be something that you have to optimize consciously.
Yeah, exactly.
Because we're really limited in our ability to accomplish that. As soon as you quit focusing, boom, you go back to the previous posture.
Exactly.
But by restoring movement, you release inhibition to muscle function, and then there's a natural ease of posture and a natural ease of movement. So this is an example of the whole body work that we do here at Hesch Institute. And I will see you only 3 times. That's all that's necessary. And we'll teach you some very simple things that you do yourself that keeps this benefit.
Yep, I'm very excited.
Thank you for letting me film.
You're welcome.